there's several important key takeaways. So one is I think most of the data that we use to make clinical decisions should be level 1 evidence or randomized clinical trials. For sublobar resection, there's two most recent clinical trials, CLGB study, which was recently published in New England Journal of Medicine in 2023, demonstrated that sublobar resection, and that includes both wedge resection and segmentectomy, was equivalent in terms of overall survival for patients with peripheral tumors that were 2 centimeters or smaller. And this was a really groundbreaking study, which really kind of guides our current clinical practice. The second study was from Japan, from the Japan Clinical Oncology Group, which compared just segmentectomy to lobectomy. And again, in this study, they found that the survival rate actually was slightly better for the segmentectomy group. However, there was a higher local recurrence rate for the segmentectomy group. But nonetheless, these are two important studies which demonstrate that performing a lesser lung resection is appropriate when the tumors are 2 centimeters or smaller and peripherally located. The other key takeaway is sublobar resection, although it is equivalent in some studies to lobectomy, it's still important to get adequate surgical margins and to perform a adequate lymph node dissection with sublobar resection. These are still important oncologic principles that still apply to sublobar resection. So I think that's a key takeaway, for surgeons that are performing sublobar resection, to remember those two important oncologic principles, obtaining adequate surgical margins and performing an adequate lymph node dissection. Some of the important findings in these studies, comparing sublobar resection to lobectomy, is it's important to ensure that patients are properly selected. Tumor size is critical when deciding to perform a sublobar resection. In the studies, 2 centimeters or less was kind of the target tumor size. Once the tumors get larger than 3 centimeters or 2 centimeters, then the outcomes really aren't well known. And I think the larger the tumor size, the higher the risk of a local recurrence, which could impact long-term survival and often lead to a second intervention, either another operation or radiation therapy. So I think it's really critical to use good patient selection in terms of tumor size and tumor location. Also, patients that have multifocal tumors within a lobe probably aren't good candidates for sublobar resection, and these patients should probably be considered for a lobectomy. So even though the sublobar resection does have some benefits in terms of preserving lung function, it's important to adhere to good oncologic principles, ensuring that surgical margins are clear and that adequate lymph node dissection was performed.